Hi, I'm Jessica Ackerman. I am a speech language pathologist. I'm a yoga teacher and a meditation teacher. And I am here to talk about snoring. And throughout my career of 22 years as a speech pathologist, I specialized in swallowing disorders, throat, face anatomy, and physiology. And so I have a specialty in the areas in the body that make you snore or can help stop you from snoring. So I would love to share with you a little bit about how snoring takes place, why snoring takes place, sleep apnea, obstructive sleep apnea, and how we can get by and heal and treat these processes before needing a CPAP machine or any other more invasive procedure or treatment. So let's dive in. I have a few slides to share with you, and I just want to show you visually what this looks like. So I am going to give you a typical night with a snorer. So we have clearly someone who is open mouth posture, struggling to breathe, probably soundly asleep as the partner is having a tough time covering ears, jabbing in the ribs, trying to get this person to stop snoring. Here is one of the treatments. Not fun, does not look like a good time. Gotta tell you, this is a CPAP. It is continuous positive airway pressure, which basically blasts your anatomy open, your nose, sometimes over your mouth, and opens those airways for you to be able to breathe when you're sleeping. And note that we're sleeping on our back. And I will go through the next slide showing what's happening with your anatomy when you're sleeping on your back and you have sleep apnea, which causes snoring. So normal breathing, we have the air going in your nose, ideally through your nose only because your mouth is closed. We like closed mouths, and I can tell you why in our next video. And the air is going through, bypassing that little hangy dangly thing in the back of your throat, which is called the uvula, the end of the soft palate, and it's bypassing, going down into your lungs. Now, when you have sleep apnea, obstruction is occurring because the back of your tongue, the back of your soft palate, and your epiglottis, which is further down in your throat, another little hangy thing, but it's further down. All of those things are a little bit swollen, maybe a little bit overweight. And in those cases, the back of your tongue is contacting the back of your throat. Your soft palate, your uvula is squished down, and that air is not able to bypass your anatomy. So what happens is it creates almost a vibration in the back of your throat, which causes the sound of snoring. And it also impairs the ability for you to breathe. And so basically, your airway is collapsing in on itself. Your air is not able to travel freely to your lungs, and it's very disruptive to your sleep and your partner's sleep. This is another visual that just shows that same thing. That triangle shows the blocked airway. So it's very detrimental for a lot of reasons. Your ability to breathe is certainly cut off. This slide just shows all of the consequences of obstructive sleep apnea. And basically, it is not just poor sleep. It is an actual physiological issue, stress on your heart, A lot of people who have sleep apnea don't even know it, but there is a 3 to 6 fold times chance that you have a stroke if you have sleep apnea. There are significant heart risks, significant increase in risk of sudden death and cardiac arrhythmias. So these are very real things caused by obstructive sleep apnea, including medical cost of $200,000 per year per person who has sleep apnea, they're saying. In terms of poor sleep, that causes mood disturbances, daytime sleepiness, which can cause increased chance of motor vehicle accidents, distracted driving, falling asleep on the job. These are not things to play around with. In terms of loud snoring, you're disrupting your partner, your family, increased risk of diabetes and obesity, and also intestinal disorders, GERD, sexual dysfunction. 80% of people with sleep apnea have sexual dysfunction. So these costs and tragedy of having sleep apnea, it's not just disruptive. It's not just, oh, my partner snores. This is a significant issue for health, for wellness, for mental health, for your ability to participate in day-to-day living. So snoring is not just a pain in the butt. It's not just, hit him in the ribs and get him to roll over and put in your earplugs. Snoring is an actual medical diagnosis. Obstructive sleep apnea, or OSA, carries a huge burden. So we want to get into how to fix this, how to remedy, how we can do things to treat obstructive sleep apnea without actually using that CPAP mask, without surgeries, without needing to put in um, implants. There are devices that are calling for, opening your jaw, opening your mouth. And so we want to have a way, and speech pathologists like myself can and do treat snoring. So one way is myofunctional therapy, and that is basically exercises to open the airway and allow for free flowing air to get by. So in my next video, I will go through some of those exercises, the myofunctional snoring and treatment for you, for your loved ones. And so tune in next time and we will go through all of those exercises, because we really don't want to leave obstructive sleep apnea untreated. This is, again, health risk, health diagnosis. It is not something to play around with. And so I'm here to bring you all the way through it. We're going to have some other specialists on to talk about it, but for now, that's just your intro, and we will talk again soon. Thanks.